I'm a project manager with Groundwork North East and Cumbria. And I was just saying, I'm sitting at home on the west coast here, and it's usually really nice because there's nothing between my garden and the Isle of Man and Scotland other than the ocean. Can't see it today because it's so drizzly and wet and really miserable out there and wild. But it's usually a wonderful, although windswept, place to be and to live and to work. Thank you, Ashley, for asking me to return and to have my own slot in here. So what I'm hoping to do is to update you on the Green Social prescribing project that Ashley mentioned. I will also bring in a little bit of work about the Northern Network of Green Hubs, because I think that might be interesting for people, and just a wee bit of a background on Groundwork as well. Next slide, Ashley, please. So Groundwork UK is we are a federation of trusts. I'm employed by Groundwork North East and Cumbria. There are 5 large trusts in the north, and believe it or not, there's actually one in Japan as well. But we do network very well together. We sign on to the same sort of mission and vision for the organisation. Really, what Groundwork are about is fairness, making sure that all communities and individuals have access, whether that's to education, healthcare, job opportunities, green spaces, and we're one of the biggest charities, environmental charities in the UK. Next slide. So we've been around quite a while. First trust was launched back in 1982, but I remember working with Groundwork, not for Groundwork, back in the very early 90s. And I used to send people for work experience and volunteering on the Sustrans cycle paths back in the day. And then when I came to work for Groundwork out of one of the Workington offices 5 years ago, I was a little surprised to hear that we were working on such a diverse range of projects. And I initially started with an employability type programme, but working with those who were furthest away from the job market. Just to give you an example of some of the things that we achieved last year. If you move on to the next slide. Hello, Helena. I know you saw this slide last week, but also I was so keen to get everybody outdoors, pushed outside to do our little mindfulness in the garden, that I rushed through this slide, and there will be some new stuff. It's not exactly the same set of slides as the Morton Manor event last week. So so what have we been up to in Groundwork North East and Cumbria? This first figure, it's gone up dramatically, even just since the turn of the year. 250 people helped to reduce the energy, tackling fuel poverty. We are absolutely delighted. We've got funding now for Allerdale and Copeland for our green doctors to go out and work with people in their homes, learning how to set their boilers right, learning what appliances are best to use in the home. And I think this does really have a bearing on health, because it's very difficult if people have got financial worries or they're worried about keeping warm at home and that kind of thing, to actually progress with tackling, whether that's mental or physical health barriers to a full and healthy life. So we feel it's a good provision. It's one that's very definitely going to grow. We're very experienced, back to our roots really, about improving access to nature, but also to make sure that that's safe for people. So we've worked on 7.2 kilometres of footpaths. We've been doing quite a lot of landscape restoration. I think, Maria, you said you're in Workington. News for Workington. We're working with some of the housing associations and Workington Town Council to better use some of the allotment spaces. We're also working with Garden Organics, and we're going to be having a composting site in Workington and have a programme so that those that want to become master composters can learn how to do it and share their learning with people. We are a training establishment in their own right. I come from a training background, so every now and again they roll me out and they ask me if I'll deliver whatever it is that there isn't a trainer for that day. So since my time, I've delivered on volunteering skills, personal development, food safety, information advice and guidance. So we've got quite a suite of accredited courses that we can call on if we need to, but we also like to work with other training providers who are specialists in their own area. I've just come out of a meeting of the Northern Network of Green Hubs, and one of the questions there was about, we've identified a need for environmental and climate change responsibility training, and who would deliver that? Well, yes, we do deliver it, but we'd like others to be delivering it as well. So we're very much about sharing the workload and sharing the opportunities with other organisations too. Last year we worked with 72 community groups and building pride of place, because a lot of our work that we do are out of community hubs. So I've just sourced funding for my colleague down in Barrow, and we're going to be the first, I think, in this area, warm hub that will be open 7 days a week and in the evening, staffed by staff and volunteers. First to have a community laundrette within their one hub. We do more than hand out a bowl of soup through the winter. We've supported people in various different ways. As I said before, my team work a lot helping people into work, into training. We work with Cumbria Youth Alliance as a partnership on one of our projects. And a lot of the people that come through their doors are needing support with their mental health and well-being. Some of those interventions we are able to manage because we are trained to do, but we work in partnership with others according to the requirement of the service user. We work with children and families, reducing inequality, and we've supported 416 businesses. I've got several GP practices queuing up saying, hey, can we have some of your green champions to help us to decipher the NHS North Green Plan and our decarbonisation? We haven't found the funding to do that yet, but we're chipping away at it, and we'll let you know if we manage to get there. So that's just a quick overview. Some facts and figures of what's been happening across northeastern Cumbria, but specifically in Cumbria. Ashley, if you move on to the next slide. So I'll talk a little bit more at the end of my presentation about the green community hubs and the Northern Network, because it is something that you might like to get involved in yourselves. The Green Doctor provision I have mentioned, and if anybody's coming into contact with patients that they would like to refer on for a Green Doctor appointment, at the moment we can take them in Copeland and Allerdale. Just contact myself and I'll pass them on. We love Grow, Cook and Share. So we've got some quite active programmes. We're really good feeders of people, but we like to encourage people to do it from scratch. Sometimes it works. I mentioned to Helena last week, sometimes it doesn't, like the Christmas lunch where the ground was too frozen and our poor Hannah had to go to Tesco's to buy the vegetables. We thought we were going to be taking them from the community garden. It didn't quite work. But we work with people like the Soil Association, with Tesco's, to try and get communities involved in eating healthy and looking at food source, where it comes from. And you know what we do at the end of those sessions as well, which I think is lovely? We always take extra boxes and we encourage people to take a meal home and to take one for their neighbour or grandma or someone as well. So that's where the sharing aspect comes in. Green social prescribing, I'll talk about and give you an update. And Helena, and sorry if I keep mentioning Helena, it's because Melanie and Maria, I'm not sure if I met you last week. We've got more updates since last week, so it's quite a fast moving picture, that programme. The Choices programme is coming to an end. We've been working with people with complex barriers to engagement, whether that's getting out the house or being able to deal with day-to-day living, and it's been really successful, but it was funded through European Social Fund money, and we're waiting to see what we will get from Shared Prosperity. We know it won't be as big a fund, but we're being quite positive about it. So hopefully we'll be able to help another 1,000 people with a long-term action plan of support by giving them a key worker or a first port of call to support them. I don't think anybody here is on the West Cumbria Mental Health Partnership, and if you are, forgive me for not recognising your name. That's something that I'm leading on, but it's fairly new to me since just before Christmas. I used to just take myself along and I was a participant, and occasionally I got a slot to do a presentation. But now I'm managing the project, so it's really interesting, nice piece of work, and we're looking at a future for that as well. And it's about the third sector, low-level mental health providers being encouraged to cross-refer between themselves and to support each other. So we're halfway through that project at the moment, and we've got a great website which you should be able to find quite easily. And on there you've got little descriptions of the different providers and what they specialise in. I'm quite busy at the moment putting in grants to support multicultural communities, whether they are people seeking asylum, people who have come into the country as refugees, but are coming towards the end of their time with the County Council Resettlement Office. We go along to the English cafes. We've built up really good rapport. We're getting involved with Anti-Racism Cumbria to do some work with them from an integration perspective, because during COVID, we had a lot of new people coming into the county, and there wasn't really the opportunity for that welcome and settling down period. If you're wondering why I'm mentioning this on a sort of an NHS topic presentation, it's because it's the impact on the NHS of people not really being able to understand how to access services, or to be trying to deal with their own mental health issues, or just generally life. So we've got we're building up a nice little reputation for doing that work. Just to give us an example, I happened to be in one of the working offices yesterday, and I could hear a lot of noise downstairs, and I thought, well, there aren't many participants in what's going on. And when I went downstairs, there were over 30 multi-ethnic individuals who were doing a combination of coffee and crack, information, advice and guidance, a little bit about learning about different, what's an app in English and what is an app and how do you use it to access services. And then they were going to stay on and do some food safety training. And I go along to a lot of different support services for multicultural communities, but I've never seen quite so many people in one room at the same time, which means that they must feel that they can trust us and feel comfortable coming to us. So hopefully we'll be able to do some more work along that line. The Restart Employability Programme, my colleague manages that, and it is strictly employability, but quite often for people who need a little bit of work experience first. Then the Money Mentor programme is quite new to us, but we're doing really well with that. and we have various tools at our disposal, and our delivery team are trained to work with people on a one-to-one, looking at really becoming more confident with money and reducing the stress of managing finances. So that's a bit about what we're doing here in Cumbria. Are there any questions at this stage? I'm conscious that I've talked on for 15 minutes. I'm going to stop every now and again and ask if anybody would like to ask any questions about groundwork work or anything that I've touched on there. Somebody talk to me. Anybody? Are you okay for me to continue?
Yeah, that'd be great, Kate.
Yeah.
Well,
Yeah,
my
super.
comment would be, Kate, you must be very busy.
I don't do all this on my own.
No, but very busy. Amazing work going on. Fantastic, though.
Lovely. So if we move on to the next slide, then Ashley, and then something that's obviously close to the heart of all you on this call, which is the Green Social Prescribing project. So this is it's an 18-month project, so it will run through until March 2024. It's about promoting opportunities for people to engage with nature, green and blue landscapes to improve their health and well-being. To ensure that people with health inequalities have the same opportunities. And the bulk of our work is about linking existing social prescribing teams and networks with those providers of green, blue and nature-based activities. That's just sort of an overview of it. If you move on, please, Ashley. So what have we've been doing? So yesterday was my day for doing a little bit of number crunching and starting to pull together the results of the initial baseline surveys. So we've been trying to get a handle on who is socially prescribing, what areas do they cover, who employs them. And then we're moving on to ask people, well, you know, how on average, what's your caseload? How many people are you seeing on average a month? How many of those patients or service users do you actually refer on in to green, blue or nature-based activities? And then we're also looking at whether or not they have been offered or attended any environmental awareness or climate change training at all, and looking at whether or not they have identified any, and they all have, barriers to their patients being able to engage with the activities. At the same time, we're also doing surveys with the activity providers themselves. On that third point, the general feedback there is that the activity providers are telling us that they haven't got enough contact with social prescribers. They'll say they don't know what one is. They don't know what social prescribing is. And if it would bring more people through their door, they would love to, or they just don't have the contact details. There's quite a bit of work to be done there. What we hope to do moving forward is to have a range of different both online and face-to-face events where social prescribers and activity providers can meet and can also get involved in things and have a go, because we're much more confident recommending something to our service users if we've met the people who are going to be delivering it, or we've actually had a go at that activity. I let loose Mark, one of my colleagues, on archery. He took some participants and now he just wants to go out and do archery. And then my other colleague, Fatima, he sent me a photograph of her climbing a tree, which, not that we want everybody to go out and climb a tree, but because Fatima led on climbing a tree, then the couple of less confident participants she took with her, they wanted to have a go as well. And then she was confident about recommending to them that they go and join in with this outdoor centre's range of activities. And I will talk in a moment or two about the grants, but just to give you a little bit of prior warning of the kinds of things that are going to come out of this baseline survey, this initial one, and it is an initial one, and I'm just pulling together the graphs and the report, but I will make sure that it gets out to yourself, Ashley. I'll send it to Laura, and it will go out to the Green Social Prescribing Network, as well as going to the steering group as well. So if you move on to the next slide, because this is actually quite interesting. So when we asked social prescribers what their knowledge of nature-based activities were, what's the difference between green, blue, what kind of thing have you got in your area? Do you think that there's any benefits of it? Generally, as you can see there, it was a big tick. It was looking quite good. There was nobody said they scored themselves 10 out of 10, but that was really, really promising. But then when we started to delve a little bit further in terms of, well, how many or what percentage of your patients or service users do you refer to? That's when we got a different picture. Now, the statistics, we know they're not going to be exactly right. They're going to be hopefully a little bit more than a guess. But what we've done is we've tried to divide the data into NHS employees, connector team, the NHS social prescribers, connector teams, then county council employees, and then third sector. So when you talk to somebody working in the third sector, or somebody whose post is funded, there is very, very strict in terms of recording. How many people have you seen this month? How many people have you referred on to this or that or the other? So it's just the norm. We just do it. So if I do a caseload review with one of my key workers, it's just right off the slip of the tongue. Okay, I've seen 30 people this week. I've 30 people this month. I've got 30 on my caseload. No, I haven't, sorry. I've seen 29 because one's in hospital poorly. Out of that 30, how many have you referred on to green, blue, and they'll come back with 15 or whatever. And if I want to track that back to their records, I know it will be right because we are being monitored on that. But when myself and Hannah have been asking the question of many of the social prescribers, they've been a little bit vague. I think it's around about. I think it might be 50% or it might be 25%. I don't want to make a rod for people's back here, so I'm probably going to, for this first survey, have to go with the information that people could declare to us, but I'm also putting a bit of a caveat in there that we don't know whether it's exactly right. And so also that meant, if you move on to the next slide, the sums don't quite add up because we weren't able to put any data in for some people who joined in with the survey with all the other questioning, but they really didn't know what to answer for this section. So this is a bit of a work in progress. The next slide's quite interesting, and this is about barriers that are being identified. If you move on again, Ashley. So we asked the social prescribers why they felt that they were not able to refer, or that their patients didn't take up the opportunity that they were putting to them. So access to, this is in priority area, it's priority list. It's more people said access to suitable activities in the area. So there might be quite a lot of activities in the area, but what we were hearing was, but they're not suitable for our clients. So somebody said that they dealt with a lot of people with autism and younger people. It was a youth support worker, but they couldn't get them to engage with established groups that were there, that had to do something in the interim before they were moving them on. So we need to delve a little bit further into that. But when we know who who is wanting to commit to more of this type of survey, we maybe use a smaller number but delve a little bit deeper with the questioning. Transport was invariably there. Some mentioned costs of transport. Funnily enough, nobody mentioned costs of activity, but costs of transport. And then either transport not being available or people not having the confidence to use transport. Come across a really, really good potential project with Maria. If you work with Neem and Laura out of the Work It in GP practice at all, they have a little walking group that they run themselves every Thursday morning, and by coincidence they use the same venue as us for a cup of coffee afterwards when we do our arts and crafts. And what they would like to do is take the participants further. They would like them to be able to enjoy the lakes and the fells. Now, probably, well, they've identified that the closest point from Workington to take them to would be Buttermere or Crummock, which is accessible by bus. But if they were to suggest that to any of these people in their walking group, they just wouldn't go. So what they're planning to do is do a phasing in of it. So they've got them nicely established as a group. They all meet together, they go for a walk around Workington, then they come back and have a cup of coffee. Hopefully, if we can get them the funding, they will then organise for them to go in a minibus as a little group and go and have a walk around a lake or part way around a lake, because they're building the fitness up as well. But they would go with their social prescriber. And then they would, the next time they wouldn't go in a minibus, they would buy everybody a bus ticket, but everybody would go together. And what we're hoping that is that they then form little social groups that we can then maybe buy them the bus ticket and then them go on their own without needing, you know, anybody else to go with them other than the established group. And then they can work together on that. I have experience, both myself and Shayla, my colleague, have experience of this. We were working with 4 people who had been bereaved, 4 ladies actually, and we wanted them to go onto some walks that were specifically for people who had been bereaved. 2 of them had no way of getting there at all, and the other 2, well, all 4 didn't have the confidence to go on their own. So Shayla and I, we went with them at the weekend. We managed to get them there. We got them suitable footwear to go in. The participants were able to meet up with other people that they could talk to that had had similar experiences to them. And even though it was chucking it down with rain, I met up with one of these participants last week, and both of us said, "Do you remember when we went round Loweswater in the rain? How soaked were we?" But what happened was they formed little peer groups as a result of it. So one of them has actually set up her own walking group, and the other 3 have returned to that bereavement walking group we introduced them to and continued to do it. But they would have said, "No, I can't go on that walk because it's a transport problem." We had to do that sort of earlier step for them. The next one down, it rather contradicts my first slide with my first slide with the graph on about lack of knowledge of what is available. But when we did get to this question, we had a large number of the contributors who said they weren't really sure about what was available. They knew what it was, but then they didn't really know who did what and who owned the activity or how to refer in or that kind of thing. So I suppose that justifies the need for the project, which is grand. Quite a few comments about patient confidence and anxiety and motivation, and you would expect that. An interesting one there is patient awareness of the benefits of the outdoors. So maybe something to pick up on, Click, from your role there. Not as many commenting on physical ability being a barrier as we had anticipated there, actually. Timings came up. that people felt more socially isolated at the weekends and in the evenings, and that was the time when they felt that they couldn't go and join in with things, but there wasn't anybody to support them at those times to be able to go. And then, of course, I've mentioned a couple of times social prescribers accompanying or facilitating something. Is that supposed to be within the role, or is that something that's evolving because there's a need there? And maybe looking out at today, weather should have been at the top of the list, but only 2 people mentioned weather. So that was grand. I'll take any questions on this bit, just as I don't know if anybody would like to comment on what we've found out so far. You're quite a lot this afternoon.
I was going to say, Kay, from my perspective, it's trying to get across to people, isn't it? About it, it's very holistic, isn't it? And it's almost like meeting those basic needs first to then be able to improve your overall health and well-being, isn't it?
Yeah.
So just shows, the importance of it, and trying to make people see the benefits of going outside and meeting other people, and the socialization and all of that is just so important, isn't it?
Once people get into it,
Yeah,
and they
that's
know that it makes a
it.
difference. And I think we'll
Yeah.
have some great case studies
Mm,
as a result of this project. But that initial encouraging and having the confidence in an activity
definitely.
provider and actually getting the person there as well, that's the biggest hurdle
Yeah,
to get
yeah, of
over, I
course it is,
think.
because this, where they are mental health wise and things like that, just getting out of bed can be huge for some
Oh,
people,
yeah,
can't it? So, yeah.
yeah. So I can't remember what I was going to talk about next, but hopefully the next slide will remind me. The grants. Okay, sorry if some of you have heard this before, but Cumbria Community Foundation have a number of £5,000 grants for green social prescribing initiatives. I've just been in conversation with them this morning. Although there's been a lot of people inquiring, there aren't a lot of applications coming forward. Now, sometimes they come in on the day or the day before. People actually work right to that deadline. So I wouldn't be surprised if that doesn't happen. I put in an application for funding yesterday at 12:30. Panel was sitting at 1:30. So it does happen. But these were launched not that long ago, and my own personal feeling, and I've discussed this with Steph, I'm not sure if you're on the call, Steph, or not, is that the social prescribers know what they'd like to see in their area, and they've got great ideas, but they can't actually apply for the grants. So they need buddied up with, say, a charitable organisation or a community interest company to put the application in, and that just takes a little bit of time to suss out who's doing what and getting paid what and what they need and what have you. So it's not just me putting an application in for something that I've got an idea about. It's the whole coordinating the social prescriber activity provider link. So they are hoping to sit again, maybe mid-April, and then hopefully in September again, but it will be first come, first served. The applicants as well must be linking into the specific target group and area. So we've had a lot of calls from Morecambe Bay Trust area. We've had to say, sorry, it's an NHS North initiative. But it's ticking along, and if anybody wants any more information about it, if you'd like to contact myself, and I can talk you through the application form, give you some suggestions of what might make your application stronger, and if required, put you in touch with others that might be willing to work with you on that. One of the things that's come up, I know there's possibly an application coming in for walk leadership. I think it's been done before through Ramblers, but I think they might be putting a different application in. This one is through Mental Health North West, and that would certainly give any social prescribers that are going down that route of actually doing some activities outdoors with their own clients, the right qualifications, credibility, and also a bit of a legal steer there as to what to do and not to do in different circumstances. So yeah, so interesting. So I'm keen to know whose applications actually do go forward next week, and we'll just continue to work with anybody else that would like to put an application in. At that point, I'll ask, is there anybody with any grants questions at all? Okay, I'll move on then. When you said, Ashley, I had nearly an hour, I thought I'll never talk for an hour. I'm just watching the clock here. I have a way to go. So different topic. So Green Community Hub. So Groundwork North East and Cumbria, along with 4 other trusts, have joined a northern network of hubs. So what is a green hub? It's a place that brings people together. It's a way of building happy and healthy communities and helping people to make changes. It can be a place, a physical place, you know, like a park or a building with a garden or a forest or whatever. But we've actually created one in Workington, brand new hub, which is the whole of Workington, because we wanted to spread it out so that all residents were able to be a part of it rather than making it too small. And we also acknowledge that in Workington, sometimes people don't want to go to things that are on a different estate to where they live. But with the northern network of hubs, any individual or community group can join the network. We've been put in touch by the North Cumbria Hawks with allotment holders in Carlisle, and we're hoping that they will join the network. We're working with people like Growing Well, who have got such a lot of experience over in Kendal, not in our patch. However, they're also opening up sites in Carlisle and in Copeland, so they'll join the network. And those members of the network, they'll get newsletters, they'll have the opportunity to join hub events. There was one at the Beacon fairly recently. They'll share resources, they'll get information on grants and ideas, etc. I've put some links at the very end of my slides to anything that I mentioned, so that if anybody's interested, you can look that up as well. So with the Workington Green Community Hub, we've got a series of projects. So the first one that we're working on is funded by, I've put Northern England there, it's Natural England. It's funded by Natural England. We're having 5 events on in 4 different estates in Workington and 1 in the town centre. And we have some delivery partners ranging from Garden Organics to Rivers Trust to Together We to the Wildlife Trust. There's a host of them, and they're all doing different things at the events. And any social prescriber or anybody else that wants to bring their participants along, please do. They get goodie bags. They are get an opportunity to go into a prize draw if they complete the survey for us, which will inform our training needs analysis of what educational events we should put on in the future. So for example, we've got one community group that would like to create a free food forest or a little orchard, and the planting will be fantastic. And then in 2 or 3 years' time, the trees will go all over the place. So they may need some basic arboricultural training so that they know how to snip away and not take the thing that's going to produce the apple next year or whatever it might be. In addition, we've been helping the local council to develop a Be Happy therapy garden, and we've got different everything from yoga teachers to drummers to all sorts who are going to have events there. So that's all exciting. We've had some children involved designing posters and banners and things, and we're getting them a lovely bench where people can go and sit and meditate. We're refurbishing a self-sustaining community use building in the Vulcans Park at Workington. So we're looking at how can we do the remaining refurbishment of that building so that everybody can use it, gives access to a community garden, but they won't be thinking, well, we've got to wash our hands in cold water. So we're hoping that by doing the appropriate assessment at the start, the refit assessment, we can identify whether we need solar panels or whatever to try and keep the costs down to nothing if we can. We've got an arts and garden therapy group, and we're developing a first composting site for Workington. So watch this space. And I've visited one, and I can assure you, Maria, they don't smell. Because I wondered when I went to one, I thought, oh, am I going to have to? But no, they didn't smell. So again, any social prescribers are very welcome to bring their service users and patients along to any of these events and anything that we're doing. We post it on our Facebook pages. We've got a Facebook page for Green Social Prescribing now, and we've got one for Green Community Hubs, and the links are on the last slide. And then next slide on, Ashley. Oh, a few photos. Right. So on the right of my screen, we've got Fatima, who is doing some nature-based work indoors because it was chucking it down outside. And that's really just demonstrating that you don't actually have to be outside to be getting involved with nature. Hannah's in the middle there, working with our the Workington Green Angels, and we were doing bulb planting in a couple of church premises and in the park. And on the left there, that's my colleague Andy, who he encourages his participants to get out on the bike, and he has to practice what he preaches. So we had him going to all his appointments on his bike, and he's now as fit as a fiddle. He's actually become one of our green doctors, so he very much is all singing, all dancing green. And you see those feet on that photograph, and those are some of the people that were on the bereavement walk with us. They didn't want the photographs taken, so we took feet. And then I think that is Geordie's Hands, who worked for the Wildlife Trust, who's just moved on from that job. And at one of our events, she was making feeders for the birds and the wildlife and what have you. So all the children from Northside School in Workington and the parents, as they were passing the community centre on the way home from school, Hannah dragged them in and got them all doing that with Geordie. So there's various different ways that we can embrace with nature and benefit from getting as close to the outdoors as we possibly can. So next slide, and I think that's what's next for us. Yeah. So this report that I'm working on, I will get that done as soon as, well, as fast as my little fingers will type in the time that I've got, and it will be going to the Personalised Care Steering Group meeting in March. We will continue to facilitate the events, but we're planning one at the West Lakes in Copeland, and we're planning one up at, oh, I've forgotten it. Is it just on outside Carlisle? And I think we've got some ideas for somewhere in Eden, but we've at least 7 that Hannah is currently looking into. We'll continue to support with the grant applications. Oh, and an interesting one here. We're collecting all this data. We've got to put it somewhere. So we're working really closely with Public Health and with Craig Robson from MEC. And we're also working closely with the social prescribing team in Copeland. There are 2 portals there that we're going to hopefully get our data entered into. And once that job is done, and I don't know how long it's going to take to do, but I think it'll be something that's ongoing anyway. But I know Hannah's sitting on about 200 activity providers that she needs to get populated into something. So bit of a work in progress. But when that's done, we'll send the links out again, and because we did send them after our first green social prescribing meeting to see if anybody had any objections to us using MEC. We haven't had any objections coming forward at all, so we'll progress on with that. And I think that hopefully will provide a maps-based approach to people who are sitting doing their green social prescribing, looking for where they should be sending their patients to. And obviously we'll continue our green community hub and green doctor work. And then I think the last slide, Ashley. Yeah, so you've got mine and Hannah's email addresses. You've got the 2 Facebook pages there. You've got the link to the grants, but I would encourage you to have a chat with myself or Hannah if you're contemplating that. And Claire, I've got your green plan in there. You'll be pleased to know. Thank you for helping me with that. And I have been recommending it and sending it out to anybody that I chat to and trying to use it as a bit of a, it's a directive from NHS North, and some of these things that we're doing, they link back to this original document.
Great, thanks, Kay.
That is me. Gosh, ready for a cup of tea now.
I bet you are, Kay. Thank you so much. I really do appreciate it. Has anybody got any questions for Kay at all? Any thoughts or comments? Oh, Helena's popped something in the chat.
Thank you, Helena. Hello, Hazel. I've just seen that you're on the call. Nice to speak to you again. We had ages, Hazel and I, trying to speak to each other, kept missing each other, and now we've spoken 3 times in just a week.